The biggest concern for any runner is injury. So in today's video, I'm going to take you through my 5 top tips to reduce the chance of this happening. And we're going to start right now. Tip number 1, and I genuinely think it is the most important, and that is load management. Now, what do I mean by this? Well, ultimately, all of the tissues in your body are incredibly good at adapting to changes in load, as long as that change in load is built up gradually, slowly, and progressively over an adequate period of time. What our tissues tend not to like very much is a significant increase in load in quite a short period of time. And this is probably when you start to notice niggles or areas of the lower body starting to get a little bit sore. This leads us nicely on to point number 2, which is rest. Now, we've already discussed load, and we reckon there's 7 to 8 times body weight going through one leg when you run, which is a lot. And therefore, it does take time for our tissues to adapt to the strain. Now, that soreness that you get after exercise or after a run the next day, delayed onset muscle soreness or DOMS, is those tissues trying to repair themselves so that when you put them under the same degree of load the next time, they can cope with it better. So our bodies don't like being put under stress, so they adapt and change. And that's where the load management comes in. We try and do things slowly so that we give our body time to change. But part of that requires rest. So if you put all your runs in quick succession back to back, you don't give those tissues time to adapt and change, then you are increasing your risk of injury. So consider spreading your runs out during the week and rest in between. Tip number 3 is ensure you listen to your body. Our bodies are pretty good at communicating to us when we are doing a bit too much and when we could be pushing a little bit harder. Now, the rule of thumb when it comes to running would be that things don't have to be completely pain-free. It's important to point out that this is specifically when we're referring to soft tissue discomfort, so muscles or tendons. This does not count if we are talking about bone symptoms. So if you have shin splints, for example, it is not recommended that you work into any pain at all. Things should be pain-free when it comes to bone pain. But if we are talking about muscular discomfort, it doesn't have to be completely pain-free. If it's low level, it's manageable, and it is not causing too high levels of discomfort for more than a couple of days, then we normally would suggest that that is an appropriate level of discomfort to work into. So a little bit of increased discomfort that's manageable for a couple of days is safe to be working into. More than that, you are probably doing a bit too much too soon, and less than that, there's maybe some scope that you could be pushing yourself slightly harder. Tip number 4 is ensure you're listening to signs of fatigue. Now, this kind of feeds into what we were just speaking about in terms of aches and pains and niggles, which could be a sign of fatigue. But have a think about other factors like the sleep quality that you're getting, the nutrition that you're putting in your body, and how stressed you might be feeling. If you are a runner, we've all been on those runs where you start off and you're in the middle of your run and you feel like you're floating and you feel like you could go forever. And there are other days when you go for a run and everything just feels like hard work. Your legs feel like lead, they feel like treacle. Now, this may be because of a number of different factors, but it's probably because you're feeling tired. And on those runs, they may be the ones where you're not aiming for a PB, where you're not aiming to significantly increase your mileage or your speed. So it kind of goes into the point about listening to your body, but appreciate that there's lots of different factors that can affect how you feel, and you want to take those into account when you're increasing things. Last but not least, tip number 5 is try to include some strengthening exercise into your routine. We now have an abundance of evidence that tells us that strength exercise for the lower limb can significantly reduce injury risk. So we're thinking about the calf, your quadriceps, your hamstrings, your glutes, and even some core exercise can help make sure you've got a nice trunk position when you are running. Now, when it comes to strength, you want to try and build up some foundation level of strength, so strength where your feet are in contact with the ground and you are lifting heavier load. But you also probably want to consider some plyometric strength exercise. And plyometric exercise is where your feet are coming off the ground. It looks more like running, it's a bit more functional, so hopping, bounding and jumping type exercises. I hope you found today's video helpful and those 5 tips go some way to reducing your risk of injury when running. I'm sure I've missed a couple, so please do let me know what you do to reduce your risk of injury in the comments below. And I really hope you don't need them, but I have got a couple of guidebooks in the description below for knee pain and hip pain if you are struggling with any niggles. I do also see a very limited number of private patients every week, so if you would like some less generic and more bespoke advice, then please feel free to have a look at booking one of those. And if you found today's video helpful, please do like and subscribe so more people see the content that you've found useful. And whilst you're doing that, I'll see you in the next one.